So I'm with Alan, and we are talking about our latest device, which is ShockWave Therapy. What do we use this for, Alan?
So we use it for a lot of things. I mean, we can use it for cool sculpting patients, but typically we refer this to our erectile dysfunction patients.
Kind of cool. And how does it work?
So basically the way that it works is it fires acoustic energy and it pulses. It sounds like a little gun, but what it does is it vibrates with the bullet and it hits another part of the metal and sends acoustic energy into the cells and essentially creates growth factors, proteins in the cells to kind of help stimulate regeneration.
And so if someone wants to try this, how many treatments do you recommend for them?
In terms of erectile dysfunction.
Uh-huh.
So it all depends on their SHIM score. So this will be a score that we will determine when you come into the office. So depending on the severity of the erectile dysfunction, typically we either start from 6 treatments up to 12. So once again, depending on severity.
And what's your frequency? Do you do this once a month, once every 2 weeks?
So we typically would say you come in once a week for 6 weeks to get the treatments done if you're doing 12. Once again, if our patients are out of state or it's more difficult for them to get here, we can do twice a week. So then it would be for 3 weeks, but that's about it.
Let's try her out.
All right.
Turn her on. This is for doctors, and it's not an all or nothing with erectile dysfunction too. Some people think it's like it either works or it doesn't work because there's degrees of how much function you can have.
Exactly. So it depends. Some people can actually get an erection but cannot maintain it. Some people cannot even get an erection at all. So there is a huge discrepancy in erectile dysfunction because you can be on one spectrum or the other.
Okay, here we go.
Okay, ready?
Ready? 1, 2, 3, go. Dr. Samia, this is for you.
I can't.
Okay, let's try that again.
Okay.
So I want to do that for once a week.
And that's pretty much it.
So this would be, this would be the ultimate Valentine's Day gift for Dr. Samia.
It sure would.
She's shaking her head no on the other side of the screen, Dr. Samia, she's watching this. Okay, anyway, wow, what a great treatment. It's actually not painful at all.
It's not. You don't need any numbing, no lidocaine. We will typically pair this treatment with a P shot. And that is taking your PRP, taking your blood, spitting it out to get the PRP, and then inject into the muscle, and then to help kind of the healing process, and it'll speed up the functionality improvement of it.
And I like this because, if you're doing the little blue pill, you have to pop this in, you have to time everything, versus this, you just have better function, better vascularity. I think it's just which is a nice thing. Can you do this on women?
Yes, absolutely. This is also treatment that is offered for women to increase sexual sensitivity and just in general improve their overall sexual wellness. This is absolutely safe and catered for women as well.
And this is the same device you would use, for example, if I had kidney stones and I wanted to break this up.
Absolutely. So clearly the power that we're going to use for erectile dysfunction and sexual wellness is going to be significantly less. But this device is actually able to be used for a lot of things, such as like tendinopathies or such as like plantar fasciitis, which is pain on like the bottom aspect of your foot. This helps improve that pain and help restore blood flow, but also kind of reduces that inflammation in the area. Or you can take it all the way up and blast the kidney stone if you want to.
Awesome. All right, let's get started.
Sounds good.